Joining me now to talk a little bit about his practice at the San Juan Regional Medical Center Spine Center, Dr. Paul Davis is joining us on the phone. Dr. Davis, good morning.
Good morning. Hi.
Thank you for being with us, and I appreciate you calling in this morning to talk a little bit about the work that you do and the procedures that you do. But it's somewhat timely because we're just hearing some news about some trials of a COVID-19 vaccine that have been kind of put on hold because apparently causing some problems with patients' spines in this testing group. And I know maybe you're not directly familiar with this study and these trials, but would you mind commenting a little bit about how this could happen or what could be going on with the spine and how it reacts to virus infections?
Well, the spine and the brain are generally fairly protected because of the blood-brain barrier from infections. But infections and inflammation open that up, and that can cause reactions or passage of infectious agents, sometimes across the blood-brain barrier. Viruses could also cause a reaction or stimulation of the immune system that could cause an aseptic meningitis or just an inflammatory effect on the coverings, the meninges, the coverings around the brain, or in the spinal fluid. I mean, there are some reports of encephalitis, in other words, true infections of the substance of the brain itself being caused by the COVID virus. So that certainly can happen. You can certainly have a reaction in any part of the body to something that's injected, dependent on the stimulation of the immune system.
Sure, understood. And so, and again, the more I learn about the human body, the more fascinated I am as to just how it protects itself and really tries to heal itself in some cases. And so talk to me a little bit about the work that you do at the San Juan Regional Spine Center. And I imagine you deal with some of this once in a while, but these types of things are fairly rare, right? These infections and some of these viral things that you're talking about?
Yes, thank you, Scott. Yeah, the COVID, the cytokine storm and the types of things that happen that are very fulminant infections, as you know, they're unusual things. I mean, generally it's a pulmonary effect of the virus because it's inhaled and it affects cells that are part of the lining of the respiratory system. But yeah, they can break out into other areas of the body and cause more fulminant inflammation or damage to those areas, and thankfully that tends to be less common than just the respiratory infection. But insofar as what we're doing, we've kind of returned to at San Juan Regional to elective activity,
right,
as of the end of July, and we've been very cautious about that. We're testing within 48 hours for the presence of the virus or positivity of the antigen in anybody that comes in for any kind of care. And of course, the care of patients that come in for elective surgery, especially spinal surgeries, they're sequestered in a different part of the hospital, different operating room, different elevators are used, different floors of the hospital for the care of those patients, which are completely separated from the area where the COVID-19 patients are being cared for.
Understood. And so with that, are you seeing then more folks coming back to your practice with back trouble or things that you can help them with while this has been resumed?
Sure. We've been trying to get people to come back in. I think that, I've been proceeding with elective surgeries through July, through August, and, all of that's been done safely. I mean, we haven't had, to my knowledge, I haven't had anybody that has contracted an infection of the virus, either the virus or any kind of infection, as a result of their surgical management or their admission. And we try very hard to get people out of the hospital as quickly as possible. In other words, I've actually sent some patients home same day from the recovery area, which is not usually that's not usually my preference. I usually like to keep anybody that's had spinal surgery overnight in the hospital, just because they can have a reaction to the anesthetic, they can have pain, they can have nausea, and just having them stabilized before sending them home is preferential to me. There's a lot of pressure from insurance companies and the payers to try to get people out of the hospital as fast as possible. But I don't know that I entirely agree that meets the safety requirement that I think is paramount in my mind, which is to get people home when you think their pain control is good, they're eating, they feel like they can manage themselves at home. But we've been very cautious about both the admissions in terms of screening people, and we're trying to get people home as quickly as we can as well.
Sure. Well, that makes sense. And so talk to me a little bit about the kind of surgeries that you do at the Spine Center, because I know for folks who have back trouble and back pain, it can be very debilitating, and to get relief from that has got to be a life-changing experience.
Well, I would tell you that back pain, pain that happens in the middle of the body, I wouldn't tell you that surgical management is really excellent at alleviating that. Most of the time it's a person's core strength, their muscular support, that helps with that. But disc herniations or radicular pain, which is a fancy name for nerve pinching or pain that radiates into the arms or legs, or difficulty with walking, what's called neurogenic claudication, which is a heaviness or numbness in the legs, which affects elderly people who have arthritic changes in their spine. Those things are eminently treatable with spinal surgery, and that we try to do as minimally as possible. We do it minimally invasively when that technique can be used to disrupt the musculature and the supporting structures around the spine as little as possible, but alleviate any of the compression of the nerves that can be responsible for referred pain that's occurring. And that can happen as a result of generally disc herniations, injury, or just normal aging can cause the components of the spine to thicken, and that can impinge upon the spinal canal and compress nerve roots or compress the spinal cord. And of course, that can have far-reaching effects in the limbs and in the ability to ambulate that are alleviated by making those areas of the spine wider again.
I see. And so, and we've been hearing from physicians throughout the pandemic here that maybe folks have been opting not to go see their doctor, or if they have an ache or a pain, they maybe are just living with it. And again, until elective surgeries come back, which they now are here at San Juan Regional Medical Center. And so, is that something you hear from your patients? Is that maybe they've waited a little longer than usual to come see you and ask you about that disc or whatever's going on?
Absolutely, Scott. I mean, there's some trepidation on the point, for, wow, I don't want to get the infection because of the low chance that I could have complications with that. And that's a realistic view. But I think the way that we've been separating the patients and screening them, I think that risk is relatively low. And again, I've been performing elective surgeries since July, all of August, and I don't know of anyone who has become COVID positive as a result of their admission, or at least that hasn't been brought to my attention.
Right. We haven't heard of anything either. So I would agree with you on that, Dr. Davis. And so with these procedures that you do, I mean, this is a very specialized, at least in my thinking, specialized surgeries that you do here. And I imagine maybe there are folks that are surprised that this can be done here locally and they don't have to go out of town to find a doctor with your skills.
Well, yeah, about the only thing that I don't do here is scoliosis, adolescent scoliosis. All the other types of spinal surgery can be performed here safely, depending, again, on the complexity and a person's underlying comorbidities, as long as that doesn't require a very high likelihood of critical care after the surgical management, and the vast majority of spinal surgeries do not. Those can be safely done here, and generally it's just an overnight stay for the vast majority of the types of spinal surgery that are done. Even fusion operations, which are done minimally invasively, when those are required, those probably are on average the night of surgery and then the next day and night. So 2 nights in the hospital, and then patients are home. And, they don't have a tremendous amount of pain. They're ambulatory. They're taking oral medications. They're walking. They're doing things, but they're certainly not back to a full level of activity, which takes a while to recover from, dependent, again, upon what's done.
Sure, right. And when folks get some of these things repaired, fixed, surgically assisted, that can also maybe ward off some other problems if they don't stay active or if they don't have these procedures done?
Well, sure. I mean, the more sedentary you are, the more that affects other systems of the body. And I'm thinking, predominantly of your cardiac function, your pulmonary function. A lack of activity would potentially make you more susceptible to illness because your body then is weakened and not as able to fend off infections and keep those systems. And again, specifically your circulatory system, your respiratory system, basically when those are not healthy or they lose the reserve that they would normally have when somebody's in a high level of health or a high level of conditioning, they tend to be more susceptible to illness. And trying to get people back on their feet and back to more activity is certainly the objective of any kind of spinal surgery.
Indeed. And so, Dr. Davis, talk to us a little bit about the other procedures that you offer at the Spine Center that maybe folks may not be as familiar with. We've talked a little bit about some of the disc procedures that you can do for the spinal cord and things like that, but what are some of the other things that folks should know about?
Well, sure. There's all types of disc surgery, both in the neck, the cervical region, the lumbar region. Some of those do or do not require fusion, kind of fusing one segment of the spine to the other. That's done less often than just simple removal of tissues that are causing compression, be that a disc or thickening of the bone or ligament or a synovial cyst. I actually saw somebody just earlier today in the office who had that kind of problem. And we also do VCFs, vertebral compression fractures, with injection of methacrylate. It's a type of glue that's used to stabilize fractures. There's then general neurosurgical things we also do. Those are also seen in the Spine Center, but we do general neurosurgical care, things like brain tumors. These are obviously not minimally invasive, but blood collections, subdurals, epidurals, those generally occur as traumatic things, but they can sometimes be seen as a chronic presentation where somebody's developed gradual confusion and a headache, and those are certainly cared for here on a routine basis as well.
Very good to know. And so, for folks that are listening this morning, again, you've been practicing here for quite a while, right?
Now it's going on 2.25 years. I started in April of 98. Yeah, so it's about 2.25 years now.
Okay, all right. 2018.
Right.
Is when you started. Well, great.
Correct.
Well,
yep.
Well, Dr. Davis, I appreciate your time this morning, and thank you for letting us know kind of some of the things that you do. Your insights into this, the COVID vaccine and some of the complications, just kind of, I think, remind us just how difficult this is and how quickly a lot of these labs and scientists are working to try to find a vaccine for this virus. But it's a tricky one, from what we understand.
Absolutely. My pleasure, Scott.
Great. Thank you very much, Dr. Davis.
Okay. Take care.
You too. Thank you so much. Dr. Paul Davis from the San Juan Regional Spine Center, my guest here on KSJE.